So Aquagold is a microneedle device which allows the physician to customize the solution which you're delivering to the patient. So traditional microneedle devices require applying a solution on the skin, whether it's on the hand or on the face, and then rolling the microneedle or using a powered device. But what Aquagold allows you to do is customize the solution, put it into the vial, which is attached to the needles, and then gently tap it along the skin. You can use Botox, you can use a hyaluronic acid treatment such as Juvederm or Restylane, which are great treatments to help rejuvenize the skin, help fine lines and wrinkles, and give an overall glow to the skin. So there's two different versions of the Aquagold device. There's a professional version with a slightly longer needle, and a home version with a shorter needle which you can use. At home, there's other solutions you can use, such as minoxidil, or other solutions which you can put into the device and do your own treatment at home. The professional version is a one-time use, where the consumer version they can use multiple times as long as they know how to sterilize the device adequately. So when you're going to use the Aquagold device, you have the needles which help penetrate that barrier and help better absorption and better penetration of the active ingredients into the areas which you're trying to treat. The treatments are quick. People come in for a 15-minute appointment. They can go back to work the same day. If they do a treatment at home, they go to work the same day. It's not an invasive treatment. So the professional model of the Aquagold comes packaged in a sterile container with the vial and then the needle tip. So when we prepare it, you open it up, it comes sterilized, and you have the vial, and then the needle head, which we don't need yet. And then you can mix your customized solution. Today we're going to mix Botox, a vitamin B complex, I like to put a small amount of lidocaine, and then Juvederm, so now it's all in the vial, just gently mixed up. You can then grab the head, screw it on the device, and then you're ready to go. You can see the customized solution in the vial, and then once you start tapping, you can see that the solution goes into the reservoir, and then you can apply the treatment to the patient. So prior to starting the treatment, I just gently wipe with an alcohol pad to clean the face. Since we are using needles, you want to make sure that everything is clean, makeup is removed, and the skin is prepared for the treatment. For the demonstration today, we're going to do one half with the Aquagold treatment and then another half with a powered microneedle system so that you can see the difference in the treatment. And it's just a gentle tap. You don't need a lot of pressure. One thing that's important while you're doing this, because a lot of times you can't see everywhere that you've treated because it's such little needles and little holes, is to have a pattern in your mind of how you're going to do the treatment, whether you're going to make lines or circles or anatomic regions, so that you make sure that you cover the entire face. And a lot of people ask, is this a replacement for the typical Botox and Juvederm injections that we do? but it's actually an additional type of treatment. It's not replacing the deeper injections that we do for the dynamic wrinkles or volumizing that we do with Juvederm, or the dynamic wrinkles that we treat with Botox. So we're treating the superficial layers of the skin for the fine lines and wrinkles. So the treatment doesn't need to be limited just to the face. Other areas of treatment can be the chest, the neck, the back of the hands, elbows, basically anywhere where you would put a skincare treatment. So for the powered microneedle devices, there's no vial to put the solution. So what you're forced to do is apply the solution on the skin first and then do the microneedling. And I made a similar solution this time. But you can see you require putting a lot more solution on the face. You can see around the eyes even little bits of punctate bleeding from the needle.
There are certain areas that hurt much worse than others, though. Like if you're right on the jawbone, that hurts, or on your forehead. Because I have such a tight forehead and not a lot of meat on it, just skin and bone, that'll wake you up pretty good.
Okay. So for a split face, you can see this side bleeding around the chin, lips, around the eyes, and even on the forehead, much redder. And then on this side, much less, some redness. Additionally, you can see a lot of product is going to be required for the powered microneedle device, because you have to apply it to the skin first and then do the treatment, whereas with the Aquagold, where it's in the vial and goes right with the needle into the skin, you're not wasting any product. It's being applied directly into the skin and contained within the device. Every patient is going to be different, and so you customize the treatment to your own skin. So one patient may have more sensitive skin to another, and so that's why it's important that you work with your doctor to come up with a good regimen for your own skin. One other difference when I was just watching the video there, when you're differentiating between the Aquagold device and the powered device, all the other microneedling devices is a solid needle. And when you're looking at the Aquagold device, it's the patented screw thread design. And when you have that screw thread design on the needle, you have that area around the needle which helps the product go around the needle into the skin. So as the needle punctures the skin, the product can go around the needle into the dermis, whereas the other devices are just making a hole in the skin and then helping the product go into the skin in that way. But if you look at the slide here, it shows you the vial with the needle mechanism on the top, and you can see the little plunger mechanism above it. So when that plunger mechanism is pushed, it allows the product to go into the area where it'll be pushed around the needle and around the screw thread area. There's 20 needles, and each microneedle is thinner than a human hair, so they're very small, and they're made out of 24 karat gold. There's a 600 micrometer needle in the Pro design, 250 in the consumer design, and there's a 1,000 micrometer design coming soon. If we look at the next slide, you can see the screw thread design. So you can see how the product can go through those threads into the skin while the needle is deployed into the skin, whereas with the other devices, while the needle is in the skin, there isn't that screw thread area to allow product to seep around the needle. Again, when you look at this slide, it's a revolutionary treatment. In addition to the stimulation of collagen from the needle, it's allowing the product to go around the needle. There's applications that you can use personalized at home, such as hair regrowth treatments to put in the vial. you can personalize treatments with the home device, or also in the office, mixing in hyaluronic acid treatments, vitamin compounds, growth factors, even platelet-rich plasma, designing specialized treatments for your patients. Additionally, as you saw in the video, the small size of the needles and gentle application, you get no bleeding compared to the other more aggressive treatments. Again, there's minimal mesh, so one-time use. It's a 0.6 millimeter needle. We're having a larger needle developed soon, and then also the consumer model with a shorter needle. When you look at the pathology slides, you can see the Aquagold needle, which goes in perpendicular to the skin, causes little peripheral trauma to the skin, whereas a dermal roller, which is going to roll over the skin, you're going to have some peripheral trauma as that needle pushes into the skin, penetrates, and then continues to roll over. And then this last histology slide, you can just see this evidence after treatment with the Aquagold device who had India ink, and you can see where the ink was actually injected into the skin with the device, just showing where the product was delivered into the skin. So using the device and differentiating it for your patient, it just shows a level of sophistication for the patient. You're maintaining a sterile environment within the sterile vial. You're able to create customized protocols for the patient using new and revolutionary treatments such as PRP, and incorporating products that you have in your office currently, such as Botox and hyaluronic acid, but in new ways and in different areas of the body. So you can use products that the patients are familiar with, but in new ways that they may not have thought of previously. Here's just a couple before and afters, just in the chest area, using Botox and Juvederm. On the face, Botox and Juvederm again, just after one treatment. There's a lot of questions here on what's the dilution for Botox, and there's no standard dilution that you can use. Some people are using it just at the regular dilution that you would use for regular treatments. However, you have to recognize that you're not delivering it to the same level that you would be injecting it for deeper muscles for treatments where you're treating normally in the glabella, crow's feet, and the frontalis. So it's a much superficial injection. When I'm doing the treatment, I'm diluting it at about a 5-to-1 ratio. So it's a much more dilute Botox concentration. So it's more of what traditionally a micro Botox injection. Additionally, there's many questions tonight about what dilution am I using with the HA. One thing with the solutions that you're using in the vial, you don't want to have a highly viscous solution because it has to be deployed through the mechanism of the needle. So I like to dilute it at least a 1 to 3 dilution so that it'll go through the mechanism, but sometimes even a higher dilution such as 1 to 5 or even 1 to 10. It depends on the HA that you're using. Usually a 1 to 5 dilution is what I would use. It also depends what other products you're using at the same time. Like in the video, I use the vitamin solution. I also mix in a lidocaine solution if I'm going to do other treatments at the same time. So if I'm going to do other deeper injections at the same time, I'll use a lidocaine solution with Aquagold treatment. So that way the superficial skin will be numb for when I do the deeper injections with larger needles. So there's a question about what are some suitable treatment areas that we can use for the Aquagold. In the video, we did the face. We also saw treatment of the chest and the thigh area. Some people come in looking for a treatment of the back of the hand, the neck, and if you're using any hair regrowth treatment, you can do the scalp. So that there really is no limit to the areas that you can treat it. It's just remembering the depth of penetration and areas that the patient is looking to have treated. Why are the needles gold plated? And basically the gold plating is for biocompatibility, and also because of the screw thread design, you need a malleable metal to help make the screw thread so that it'll be adequately produced. How much do we charge patients for the Aquagold Fine Touch treatment? You know, everybody's going to charge different prices depending on where you live and what treatment you're doing. So it's not really a standard price. And it's also going to depend on what product you're putting in there. So if you're putting full-strength Botox or half a syringe of Juvederm, you're going to have to incorporate that price into it also. So whether it's going to be a $500 treatment or a $1,000 treatment or a $1,500 treatment, it really depends on what you're doing. But those three prices are the range of what I'm doing depending on what it is that I'm doing for the patient. For the home version of the Aquagold, how long can the patient use it? You know, most patients, we recommend using it for about 1 week at home. And then there's a follow-up question about how do they sterilize it. So we recommend sterilizing it with an alcohol solution. And then that reminds me, the professional model is a one-time use. So we don't recommend using it more than one time or saving it for the patient and using it a second time on that patient. So it's a one-time use product. And of course, not using it between patients. Just treat it just as any other needle and syringe and put it in the Sharps container when you're done with it. What is the purpose of the screw thread design? So again, we covered that somewhat already, but it's differentiated between a regular needle and the screw thread. So the screw thread, as you saw in one of the pictures, if we pull up the picture again. You can see the screw thread around the needle allows the product to go around the needle as it's penetrating the skin, which will help deliver the product. And as you can see, as you saw in the video, it's much less messy procedure than when you're doing regular microneedling, because you don't have to apply the product to the skin before the treatment and during the treatment. It's all contained within the vial, and you don't have to waste product. Since it's contained within the vial and deployed with the needle, you don't have a lot of extra product on the skin when you're done. Understanding the mechanism of action of Botox. How does Botox actually work in these treatments? Yeah, so the typical action of Botox that we use for dynamic muscles is much better understood. And then there's the concept of micro-Botox superficially, and it's much less studied and much less understood. However, a lot of people use Botox superficially and describe positive effects. So it's something that we do, the patients see a positive effect and needs more study. So it's something that we deliver and hopefully have more scientific information on as we go on. There's a question about the before and after pictures we showed. Were they after a single treatment session? Yeah. So that was those are my patients. Let me pull up those pictures. Yes. So this is before and after treatment, and it was a week after the treatment, and it was a Juvederm and Botox with the Aquagold professional device. How much product did you use for the chest? So I used, it was 1/2 of a syringe of Juvederm. That's what I used for the chest. So you're hardly using any product covering a large area. Remember, it's very superficial injections. And Juvederm is just because that's what I have readily available. It's, any of the HA products that are cross-linked, I think are very good. So whether it's Restylane, Juvederm, Belotero, I think would work just fine. It's the viscosity, which I think is important. So I think it's very important to either dilute it to make sure that it'll adequately go through the device. And then this is the forehead. And this was just with the microneedling, not with traditional Botox. Well, there's one question about how often the patients return. I come about once a month for the treatment. I'd say after about 3 or 4 days is when patients call back and ask when they can book their next treatment. So, you get a little tiny bit of redness after the treatment, and then they say, when am I going to see the effect? And it's about 3 or 4 days later when they call back to the office and say, wow, I really love this treatment, and when can I come in for my next treatment? So we book them about once a month for the treatments, which is great because, traditionally Botox you bring in every 3 to 4 months and fillers, every 6 to 8 months. So this is something that's bringing them back even sooner. What other products can you put into the device? And my recommendation is to only put products into this device that can be injected into the subcutaneous tissue and into the skin. So I wouldn't put any products into this device that are made to just be used topically, because there may be preservatives or other chemicals in the device that aren't designed or meant to be injected into the skin and may cause reaction. But if they are approved or meant to be injected into the subcutaneous tissue or into the skin, they may be okay. So, but if they have preservatives in them or other substances in them that are meant to only be used topically, it may lead to problems. So just be careful in what you're using in the device. There's a question about how long treatments generally last. That goes along with about how often we generally bring patients back. But I'd say, every 4 weeks or so we bring patients back. How long you tap on the skin. And what I've found is it takes about 10 to 20 taps on the skin before you get full deployment of the solution through the needle. And then I like to get adequate coverage of the whole area. And one thing, which I mentioned in the video, is you need to keep in mind of the area that you're treating. Because it is so mild in the reaction that you get in the skin, you have to keep in mind the area that you treated already. So just have a pattern in your mind that you're using, whether you're using lines or circles or anatomic regions, and make sure you've covered the whole area. And I like to go over every area 2 or 3 times to make sure I get adequate coverage of the whole area. And you'll find, because you're not wasting a lot of product, that you don't go through a lot of product either. So it's very cost effective in the way that you're using your product. So if you're the patient's buying, let's say, a syringe of Juvederm, but they don't need the whole syringe, you could use 75% of that syringe for whatever injection you're doing, and use 25% of that syringe within the Aquagold device, or plan it that way, whether you're going to inject first and then do the Aquagold, or do the Aquagold first and then inject. Those kind of thought process. It says, what kind of vitamin solutions can be used with this device? Again, just any solution that is meant to be injected subcutaneously should be okay. If you want specific examples, you can contact us directly through the email address, and we can send you recommendations. Also, there's a lot of questions coming in about pricing, and you can contact us also directly at the email address or the phone number, and we can get you that information as well. How much product did you use for the chest? So I used, it was 1/2 of a syringe of Juvederm. That's what I used for the chest. So you're hardly using any product covering a large area. Remember, it's very superficial injections. And Juvederm is just because that's what I have readily available. It's, any of the HA products that are cross-linked, I think are very good. So whether it's Restylane, Juvederm, Belotero, I think would work just fine. It's the viscosity, which I think is important. So I think it's very important to either dilute it to make sure that it'll adequately go through the device. All right, I think that brings us to the end. If anybody has any other questions, please feel free to email us or call us at the number on the screen. And have a great night. Thank you.